Lung abscess. So where do the questions come from here? So lung abscess is most commonly tested by looking at that clinical scenario where they tell you the person has some kind of altered sensorium, whether it's because of a seizure, stroke, or something else. And that causes them to lose their gag reflex. So if that's the case, one of the questions they can ask is, you need to do a swallow test on them. So they can give you an entire case on a lung abscess, and that's where the question would come from. So some of the other scenarios for that initial setup of the question is they can even have gastroesophageal reflux, and that can cause an aspiration as well and cause a lung abscess. Or they can have some other mechanical compromise, such as they're being intubated or they're having tube feeds. Or you have a person coming in with vomiting a lot. So all of these put you at a risk of aspiration, and that can cause a lung abscess. So chest x-ray will show you air fluid levels with a cavity. It's going to be very thick walled. That's a typical appearance. And another thing in the question that'll help you is they have very fetid sputum. So very foul smelling sputum known as halitosis. So how do you treat them? And the other thing is when you often aspirate, even if it's like with a peanut or something, often because your right main stem bronchus is shorter, it easily goes through the right side. So that's another way, that's an important piece of information in a question. So what's the treatment? It's clindamycin because it's anaerobic infection above the diaphragm. You do it for 4 to 6 weeks. Do you drain it? Not typically, unless you've been on the antibiotic for about 10 days and you have not improved, then you can consider a drainage. Okay, that's it.